It is Nurses Week, which brought healthcare workers to the Capitol steps this morning to recognize nurses' work and dedication through the pandemic. They say that nurses have suffered throughout the pandemic and need help in order to stay in their jobs which they say are critical now as fewer workers are entering nursing and Wisconsin faces an aging population.
More resources are urgently needed to address the spiraling crisis of understaffing, trauma, turnover, burnout, and moral injury, all systemic problems which have all been aggravated by the pandemic.
The group is asking Republicans to increase funding to address those issues as legislators are currently working to write the state's two-year budget. And how is that budget going to impact nurses and healthcare workers in Wisconsin? Political reporter Will Keneally has more on those details. Will?
Eric, so some of the discussion that we've seen between Republicans and Democrats around the budget has been on an area of relative agreement that there is a worker shortage here in Wisconsin. So the push we heard today was how to attract and retain nurses and healthcare workers here in the state.
You know, go out there and put a smile on their face and make their day and care for them in sometimes the most challenging times of their lives and sometimes the most exciting times of their lives.
Alex Dudek moved to Wisconsin a decade ago and has dedicated their early career to helping those who need it, working first in EMS before becoming an ICU nurse, working during the pandemic.
I really love it here. This has become my family, my community.
Dudek is 26 now and hopes to have a future in healthcare here in Wisconsin, but says fellow nurses, especially young nurses, are looking for that buy-in from Wisconsin.
We really need to invest in our healthcare workforce. So programs like the governor's proposed trauma and recovery fund that would expand our funding throughout the state, it would help support our young workers who really need that extra mental health support.
This is all happening as the legislature puts together the next two-year state budget. Republicans have already taken out a handful of proposals by the governor, including expanding health insurance access to lower-income Wisconsinites.
Some of these areas could be passed as separate standalone legislation to be able to put some dollars in there. I hope the Republican-led legislature looks at that as an option.
Lieutenant Governor Sarah Rodriguez, a former nurse herself, says the state's aging population means Wisconsin needs to address this staffing shortage now.
Every single one of us needs health care. And so if we do not invest in Wisconsin now, it is going to be a crisis moving forward.
So we pushed back a little bit, asking the lieutenant governor what Republican budget items she would support in this bill. And she said that some of the education dollars that Republicans have included go a long way to helping boost the state's health holistically. Reporting from the Capitol, Will Keneally, News 3 Now.